So let's start with the conjunctivitis lecture. Um, includes ophthalmia neonatorum, which is under the same category. Now, conjunctivitis is defined as hyperemia of the
Doc, Doc,
conjunctiva.
the
Yeah,
screen is gone. We're not seeing it anymore.
I didn't do anything. No, no. Okay. All right, I'm putting it on slideshow. How is that now?
No, still not seeing.
I'm not sure what happened today. I mean, I don't do anything different. Something is up with the collaborate here. I don't know. Share screen. Okay, now?
Yes, now.
All right, good. So the causes can be bacterial, viral, or allergic, but it can result too from exposure to some chemical irritants, including eye drops, or mechanical irritation such as eyelashes or a foreign body. Conjunctivitis is common, and you will see it, and it is often not very serious. Now, bacterial conjunctivitis is the most commonly one of the common ones you will see. It's caused by Staphylococcus and Streptococcus species in acute. But for those that are somewhat acute, subacute, it may be due to Haemophilus influenza. And less commonly, other species can cause conjunctivitis, such as Neisseria, which is more causing a hyperacute, and Chlamydia, which leads to more chronic conjunctivitis. And there are other species as listed here. What are the features? Patients may present with a swollen eyelids, usually fairly mild, debris of the tears, debris. The conjunctiva is quite red, injected. Papillae may be seen, is seen in bacterial conjunctivitis. That's when there these little elevations on the lid, usually on the conjunctiva, but the palpebral conjunctiva mostly, and in the fornix. And papillae really look like red. They're red centered, and they have a pale base. A pseudomembrane or true membrane may also be seen. It's basically inflammatory tissue. It's as the name is membrane. Pseudo meaning that it is not fully adherent to the
Hi, good afternoon.
yeah,
So, what slide are we supposed to be seeing? Because we've only seen slide 2.
bacterial conjunctivitis.
It's
Hold
still
on,
on the
is it?
second slide on definition. It's still on the
I don't
definition
know what
slide.
happened today. This is weird. Seriously, this is odd because I don't do anything different. I'm scrolling down because you see, I can't scroll down on my screen while it's on collaborate. It's like how I share the screen. I wish I could just control it from the shared screen. I have to keep going back to the PowerPoint presentation. So I don't know what's happening in terms of I can't. I don't know. Let me try something else. See. Give me a sec. I'm coming. happening. Let's see. Look at that. No, now you can see what I'm doing. So back on slide three, all right,
Okay, yeah.
which is the bacterial conjunctivitis slide. Can you see now? And can you see and hear me now? That's on
Yeah,
bacterial
we can see
conjunctivitis.
slide 4.
Huh?
We see in slide 4 with the eyes, inflamed eye.
The investigations include taking a swab of the conjunctiva for culture and sensitivity, and that is sent for gram stain and culture. That applies. So if you have any patients with severe and purulent discharge, they need they may need scrapings of the conjunctiva. These photographs, which waiting to come up on your screen, I think is the compatibility of the link to the with the computer maybe. But I'm seeing from my end that the signal is not so good. Yeah, there must be. It seems like there's some compatibility issue. Not sure what to do. Not sure if it's also the speed of the computer. So although this computer was recently upgraded, not sure why it's not even. I can't even see the chat, the messages in the chat room. I'm not sure what is happening. So the photograph on the left shows a very hyperemic injected conjunctiva. The lower lid is pulled down, so you see that there is another part of the conjunctiva known as the forniceal conjunctiva, and then you have the palpebral conjunctiva, and there's a bit of mucus there. But these are little raised areas on the palpebral conj, which are red in the center, and those are referred to, you see it here. But the base is fairly pale, and these are called papillae, these little elevations, right? Protrusion of blood vessels and surrounded by stroma of the conjunctival or conjunctival stroma. Treatment, as listed here, and that includes good personal hygiene. Not all cases need antibiotics really. 'Cause you don't want to increase the risk of even resistance. We normally need antibiotics if it's really severe. You want to speed up resolution and avoid steroid use as well, unless they have a scarring from having a pseudomembrane. And some other specific antibiotics are used if you suspect it's due to Neisseria, and the patient is usually seen once and discharged and advised if anything gets worse, they can be reviewed within days. But antibiotics, if it's very severe, yes, and if patients really need speeding up of their speed up resolution, then you may consider, but it's not something routinely prescribed, not all the time. You're hearing me, right?
Yes, doc.
Okay, going on to viral conjunctivitis, where patients will more present with tearing, red eye, not so much a lot of swelling. They don't have much of a discharge either. And the signs are similar. They may also have pre-auricular lymphadenopathy with viral conjunctivitis. And another thing of note is that the cornea may be affected, and that can lead to blurred vision. No treatment usually, symptomatic relief, and avoid steroids. It can make things worse, especially if there's, you know, but if it's not that severe. But occasionally, though, if you have corneal changes and you have these little infiltrates, which are really can lead to scarring and reduce vision, steroids can help to resolve that. So in that case, it can be used. And usually, conjunctivitis spontaneously resolves. And again, important to advise the patient about good personal hygiene and not sharing linen, washing your hands a lot, and that's similar to even what we're practicing with the advent of COVID. So hygiene is remains important, very important. These photographs show signs of viral conjunctivitis. On upper picture here, you notice the lids are a bit swollen. There's a bit of crusting of the lashes, and the conjunctiva is quite red, injected. And they actually have what we call follicles in viral conjunctivitis. Follicles now represent lymphatic tissue. It doesn't have the red head, but it has a pale head, and the base of it looks red. Then the bottom photograph shows these little infiltrates on the cornea, to pinpoint infiltrates in patients with adenoviral conjunctivitis in particular. And these little spots can lead to blurred vision. Patient may complain of reduced vision, but with not typical bacterial conjunctivitis, they don't get blurred vision. They don't usually get any change in their actual visual acuity. Allergic conjunctivitis uh, includes acute, seasonal, and perennial, vernal, and atopic, and there's also hypersensitivity to drops that gives a similar picture. The common complaint is itching. That's the most common complaint with allergic conjunctivitis. Very itchy eyes, running, tearing, and they usually have a strong history of atopy like asthma. It's related. So those are the typical findings. What are the features? I list them here. They're cute. They're pretty much similar. The only thing to note is in vernal keratoconjunctivitis, they have a few um, characteristic changes like trianthus dots, which really are collections of eosinophils that have collected at the limbus, and then white, they're white top. They may have also very large cobblestone papillae. Give me 1 second, hold on. Yeah, so sure you have read that slide. We'll go on to the next one. So these photographs are photos are seen features, sorry, of vernal keratoconjunctivitis. I mentioned transus dots, which are these little white spots at the limbus. It represents collection of eosinophils and inflammatory cells. All right, so that's a feature. Notice the conjunctiva is not that clear. Has almost like a brownish tinge to it. You may see that. And this is a condition common in in children, mostly males, somewhere between age 7, 8, thereabouts. They usually grow out of it as they become older or young adolescents. The top right hand corner here, you'll see these very huge papillae, and they are so big, they call them giants. They're giant papillae, and they form what we call a cobblestone appearance. Are you hearing me? By the way, just want to check in, make sure you're hearing.
Hearing dog.
Pardon?
We're hearing. We're hearing.
Oh, I can't hear you now. We're not getting a good signal, so things are slowed. Even the getting the sides, I don't know, they're slow. Um, and then this bottom photograph is what we call a shield ulcer. So it basically has a well-defined this is epithelial cell loss of the cornea, and then has a slight opacification at the base. And this is seen in patients with vernal keratoconjunctivitis. That's why it's called keratosis involves the cornea. These patients, they don't just need symptomatic relief, but this patient would need steroids in order to reduce the inflammation and promote healing. Right? All right, treatment. Patients usually need symptomatic treatment. Cold compresses is one, and the use of lubricants. But in our groups, they do need so you need to treat also with topical mast cell stabilizer and antihistamines. Most drops we use now are a combination of antihistamines and mast cell stabilizers, um, as what are listed here. I mentioned the role of steroids, which are usually prescribed short term, not for very long. Patients are followed up carefully because you don't want to have any side effects of the steroids. So I've just listed here because the atopic type usually they have skin changes, so they usually would need some form of moisturizing cream as well. Next topic now will be ophthalmia neonatorum, which is really when a neonate has conjunctivitis, and it is a reportable condition in Jamaica. And it is usually occurring under 4 weeks old. Infection is usually acquired during delivery due to some vaginal infection or from postnatal caregivers. And the causes are listed. And usually you can have co-infection with chlamydia and Neisseria as well. But staph and strep species can also cause the similar picture. The signs are listed. Patient presents with injected conjunctiva, swelling of the lid, and a discharge, usually quite thick and purulent. Viral is another. Viruses, like in particular HSV, herpes simplex, can also lead to a conjunctivitis in a neonate as well. So just be aware. So basically, with Neisseria, you have to be aware that it can cause severe infection to the point where even the patient may have some systemic involvement, otitis media, pneumonitis. So it's a significant condition to be aware of. So it's very important to swab them. Neisseria and chlamydia produce a discharge. But chlamydia is usually a creamy white discharge. Neisseria can even um, cause ulcers in an intact hornet and even lead to perforation. All right, so I've listed some of the typical features of each organism. Um, but and I also listed at the bottom here that it's a differential diagnosis of and then a nasal lacrimal duct obstruction with conjunctivitis. Neonate, first 4 weeks of life, early parts of life, when if the child presents with a discharge, it might not just be conjunctivitis, it may also be a nasal lacrimal duct obstruction, which is congenital. But the difference is with NLD obstruction, it's unilateral. It doesn't usually even have a lot of lid swelling. Those are the features. And this photograph demonstrates a neonate who presents with that very swollen lids and purulent discharge, both bilateral. So it's important to talk to the parents about cleaning. It's very important to keep cleaning constantly with gauze or some form of facial tissue and not to reuse like a rag in the patient's eyes to keep cleaning constantly and swab them to the lab as well. in terms of investigation, you mentioned taking a swab. As you know, for you can do a gram stain to look for diplocyte. But these patients, because this is related to some STIs, should also be referred, the mother and her spouse should be referred to the GU, genitourinary or infectious disease clinic for contact tracing and treatment. I mentioned that it is a reportable condition. In terms of treatment, mild to moderate, mentioned lid hygiene before, but use antibiotics usually are given, broad spectrum, such as ofloxacin. Drops can also give, if they can't find or get those drops, they can also use tetracycline ointment, which is a very inexpensive, very accessible ointment for 1 week and until you get back any results from micro B. But if there is Neisseria chlamydia, they would need systemic treatment as well, as I stated here. All right. Herpes infection would require acyclovir antiviral, and patients are followed up as an outpatient until they. Okay, any questions at this point? Hello, any questions? Was that clear? Straightforward?
Hi Doc, I don't know if you're speaking, but it's really hard to hear if you are asking or saying
Okay.
anything. So,
I'm going to retry another computer. Give me a few minutes. I'm going to set up because the other computer it just keeps shutting down. I'm going to try another computer. Give me a few so we can do hopefully the lecture on that one.
okay.
Yeah. So I'm going to leave the session for a minute so that I can open it.